It is just a huge honor today to be sitting in the podcast studio with everyone's mentor, Dr. Abdi Sameni, DDS, FACD. Your ears were burning on the last episode on 1290 with Dr. Kim Wright. She just thinks the world of you. And she's doing a lot you're doing, building a continuing education center. And I really am all for the CE. I think it's the biggest variable to success. Watching dentists for 32 years, the ones who took 100 hours a year, they solved all their problems. And the ones who took 10 or 15, they didn't seem happy. So Dr. Abdi Sameni, DDS, FACD, is a clinical associate professor of dentistry and a 1991 graduate of Herman Ostrow School of Dentistry at USC. He has been a member of the USC clinical faculty since 98. He is a former faculty for the Aesthetic selective, which emphasizes a biometric approach to restorative and aesthetic care. He was the original director of the USC Advanced Aesthetic Dentistry Continuum for the portion relating to indirect porcelain veneers. He is the former chairman and developer of the USC International Restorative Dentistry Symposium for the Ostrow School of Dentistry at USC. In 2019, he founded the Los Angeles Dental Symposium. Dr. Sameni lectures nationally and internationally on topics related to interdisciplinary dentistry, digital photography, and its applications for dentistry, and various aspects of biometric and aesthetic dentistry. Dr. Sameni is the past president of the USC Dental Alumni Association, past president of the USC Century Club, former member of the board of directors of the Pan-Pacific Center for Continuing Oral Health Professional Education, and a member of the board of counselors for the USC School of Dentistry. He served for 6 years on the board of governors. My gosh, you're just Mr. USC. He is a former co-chair of the Ostrow School of Dentistry Scholarship Selection Committee. He's a member of numerous professional organizations, societies, which include the American College of Dentists, the American College of Aesthetic Dentistry, OKU National Dental Honor Society, and the Pierre Fauchard Academy. He maintains a private practice in West Los Angeles, California. Now, I get a bunch of websites for you. Is your private practice, West Los Angeles, California, is that the WLA Dental Center?
Yes, it is.
And that's in for West LA.
That's in West LA. And thank you for having me, Howard. And thank you, Kim, for getting me here. I don't know how things happen, but this is probably one of those spontaneous. We could have never planned it this good, and here we are. So thrilled to be on your show. You just made me tired listening to that. I got to stop working.
Well, tell them why you were also coming down here. This is Friday, and this weekend is the Dental Influencers Alliance. So if you go to influencedental.com, you're going to that?
Absolutely coming in for that.
That's the Instagram?
Yes.
Okay, now I thought that once you hit 50, you were kicked off Instagram and had to go back to Facebook.
Well, I actually am going to start Instagram because there's so much coming out of there. But what I have the privilege of is I'm around a lot of young people. I have graduates that work with me, and I've been around students for a long time. So this is where they're looking. And as a program director, it is, I feel, my job to scout people really well before I bring them onto programs. So this started a year ago in Los Angeles, and it's just very different, and I had to come see it for myself. There's a few people I have my eye on that I'd like to scout and see if I can find a way at some future date to bring them to LA. And your email came literally the moment I pressed buy on my ticket. So that kind of worked out.
Your LA Dental Symposium, I mean, you call that the International Restorative Dentistry Symposium, or what is it?
So let me give you a little history, because it's a little unclear how the whole thing came about.
Because it's a legendary program. It was at USC for, you said, 12 years.
Yes.
And now now you're taking it over.
So in 2008, at the time, our program director, a gentleman and a good friend by the name of Dr. Elon Rothstein, who was in charge of CE, approached me and said, look, can we put something together that would be restoratively oriented? And it could be a 2-day program that you could sort of find the speakers for. And I gladly accepted, and it sort of started on its first year. We had about 80 people that attended the first one. It sort of became the annual meeting for a lot of our part-time faculty to go, and we allowed access to a lot of students. 1 year led to the next, and so on. And then when our Dean Avishai Sadan joined, being a prosthodontist and somebody who was just so popular on the CE circuit.
Who was this?
Avishai Sadan, our current dean at USC.
Oh, okay.
So Avishai introduced me at different times to different people because he was running the ceramic symposium. And Jerry Sheesh was running it, and Avishai was working with Jerry. And I got exposed to just unbelievably good dentistry. And I kind of wanted to bring those people so that our group, who would not necessarily go to all these meetings, can experience that. That went on for about 12 years. And, you know, as the times are changing, and I think you kind of see that CE is changing quite a bit. There are even hands-on courses that are online, and the resources change and your outreach changes. You and I are sitting here talking on a podcast. A lot more people will be able to hear and see this, as opposed to if we were just sitting and we had 30 people watching. So I think they have big dreams to restructure and make their programs more available, more online, more streamlined, which I'm very supportive of. But I had invited all these people, and some of them, like Luis Baratieri, is not an easy person to bring to lecture for you. And the date was set. I had an option of canceling or taking it over. I kind of went to our school and I said, look, if you guys don't want to do this, I don't want to lose the opportunity. And they supported me in decision and said, you know, you can privately do whatever you like. And I discussed it with my team, and the LA Dental Symposium was born. Now, because this had the name International Restorative Symposium of Dentistry of USC, we had to sort of take a year, let those people know that this is now changing. And as of the coming year, it is just going to be known as the LA Dental Symposium. Being that this will no longer be a university-affiliated program, it allows me to bring business into this. It allows me to have, you know, side programs that may go on. So it's unwritten, but it's very promising as to what we can hopefully bring.
So where do you, I figured out in 87 that every time you went to a CE course, it was always the same people. You're in this big city, and it's the same people and over. And all the old ones who were my age back then, they all had their FAGD, their MAGD. And I put together very quickly that that when you go to a course, it's the materials going to change you. It's the people you meet. You know, if you're five, you know, you're a summary of your 5 best friends, and if you kept your 5 buddies from college who hate dentistry and don't do anything, that can take you down. And I thought the neatest thing about the AGD and CE was the people I met. Like, even on the things like the 6 weeks of the Pankin suit or 7 weekends with Carl Misch, my biggest memory was still my buddy that I met there.
Of course.
And how so funny how so many times went to a course on ortho with Brock Rondeau, but picked up something about adhesive dentistry, and you know, it's just so it's just the secret formula. That's why I'm a big fan of this podcast, because they got an hour commute to work. A lot of these speakers aren't ever going to go to Salina, Kansas, and they get to listen for an hour. And I was hoping, you know, if they listen to politics on the radio for an hour, by the time they get to work, they'll probably just, you know, go shoot themselves. But they always get one good idea. But when what year did you graduate from dental school? 91, and I was 87. Where do you think they need the most CE now? Is it placing implants? Is it clear aligners? Is it still adhesive dentistry veneers?
Okay, so now you're hitting on a topic that's just changed for me over time, okay? I think if you look at the CE, and as someone who seeks speakers, so in order to make fees reasonable for meetings, we need sponsors. The things that are most important are not emphasized on. You know, we talk about implant dentistry, we talk about major aesthetic dentistry, yet you take a look at, say, University of Geneva, and I've had the privilege of working with some of these other people just through the companies I've worked with and see what they're doing. There's a guy over there by the name of Ivo Krejci, who is essentially the director of their minimally invasive program. And what they do is they, in their program, teach their students how to seal interproximal caries and how to diagnose differently so that that beginning lesion never occurs. We just implemented that ICON process into our clinical programs, right? So the education is contemporary. Then people get out, and I've worked with quite a few dentists who graduated that are 4 or 5, 10 years out. Depending on the environment that they fall in, what they teach in dental school is unfortunately not what they're able to practice. And what that kind of comes down to is it is all about how do I do it faster? How do I do it faster? There are certain things that you just cannot do faster. Now, in a bigger scheme of things, and when you look and see how things have to be done and why is it fast, is because of the influence of the third parties that dictate what an office can and cannot do. And the paradigm shift, I think, is different. So when you ask me where should CE be, I think CE should be educating the people that before the cycle of death of a tooth begins, there must be a process that you can prevent it. Now, granted, there's a whole group of people that have restorations that needs to change all the time, but there's a whole bunch that are getting new ones every day. And there is really no consensus. The technologies that allow you to be specific are not utilized in this country. And that's a pity. I think that whole endeavor needs to get redesigned of how do you decide to enter a tooth for the first time.
And do you, it's really come a long way. So if you're young and in school and you think it's bad, I remember when I got out of school, I mean, the cosmetic dentists were just people who would file down a bunch of crowded teeth and put PFMs.
Yeah.
And I mean, when they got done prepping the lowers, they all look like rice kernels. Yep. You're like, how could that be good? So then eventually it became more minimally invasive. I love the fact that nowadays, before someone does veneers, they unravel everything with Invisalign or clear aligners. It's getting much more conservative than it was. It used to be just a wholesale crazy. But do you think it's it's rapidly becoming more minimally invasive?
I would love to say yes, but the reality is that no. Because if you look at at least in America, or in California, I should say, if you look at the direction that dentistry is going, more and more DSOs are being formed, and less sort of specialized offices tend to exist. And when DSOs put their business plans, they try to work within third-party paying, take all the PPOs they can, et cetera. So in order to, for example, do sealing of the proximal lesions, they are not going to encourage that because that's not something that's covered with the current payer system. So where I see dentistry going is a group will continue to work within the paradigm that exists and find ways to make it faster and have more centralized ways of dealing with it. And then there's going to be the groups that are going to take a different direction. And a good analogy, potentially, at least what I hope I can contribute to, is if you take a look at the organic food industry. You know, I immigrated into the United States in 1983. You couldn't find organic.
How old were you in 83?
16.
So was that stressful to change countries at 16?
You know, it's when you're from Iran, and that's where I'm from. I left when I was 12, and that was a time that I had to go alone, and I lived in a boarding school until my folks could leave the country. So I lived in Europe for about 4 years, and then we all immigrated into the U.S.
So you lived from 12 to 16 with no parents in a different continent?
Actually, 2 of the years without parents. That's where I learned how to speak English, and, you know.
And drink and drive and all that.
Not drive, because you can't until 18. So it was kind of fun, and it was hard at the time, but going through hard times makes you prepared for others. Being in an environment like that makes me be comfortable, like whether you're from Sri Lanka or America or I don't think in those terms because I'm just comfortable with like whoever, and I like to get to know you for who you are, etc. That was instrumental for me at a young age to just, you know, despite the discomfort, get along with everybody.
You know, have you heard of the company Intel?
Yes.
The 2 founders that are 2 brothers are from Iowa, and I was just asked them one time at dinner. I said, you know, you're just 2 normal guys from Iowa. I'm from Kansas. How did you come up with this? And I mean, it's a massive company. Yeah. And he said, and they attribute all to being Army brats. They said, you know, we grew up, and every 2 years, Dad transferred to another country, and we would just lay there in bed and think, well, why was the last country so rich and this one so poor? And they look at the different things. They said, same people, same house, same appetite, same plumbing, same everything. Same. So they started to understand the small little nuances of economics. And they said, yeah, we couldn't have learned that going to ASU and reading books. They lived it. So, what doesn't challenge you doesn't change you. Yep. So those challenges probably made you the person you are. So what are you, so again, back to the question, what do you think the major areas that need to be addressed with CE? I mean,
so all of it. I mean, CE is when you finish what I like to call somebody who finishes dental school is a qualified beginner, somebody who is just taught to be safe. And if they've paid attention, then they know the basics, and hopefully with some mentorship, they'll kind of grow and so on. So all of the areas you can get better at. The question is, if you sort of change the perspective of the public and what is offered to the public, and then you look at what we offer and the reasons of what we do and what we don't do, I think the reasonings that we sort of justify some of the things that we do is not appropriate. And I really think, and I think this 30 years into this, because if you asked me this, I don't know, 25 years ago, I genuinely believed I'm doing somebody a big service by taking those teeth and crowning them and getting rid of an interference and occlusally making them fit what I was taught is the best way to go. But I think adhesive dentistry is a game changer, right? Because adhesive dentistry allows you to sort of keep the tooth biologically for a lot longer. And as dentists, we're trained that if our restoration fails, that is embarrassing. But if the consequence of our restoration ends up having a patient lose a tooth, that's a consequence that we agree. And not that I am at the stage that some of the cases that are beautifully reconstructed are failing. It's disappointing. And the ones that have their natural teeth may have needed a little more care, a little more hygiene. Some of the composites may have been redone 5-6 times. They're better off.
Is that minimally invasive? I posted that yesterday. Have you ever seen something like that? It was I posted that on, it exploded on Dental Town. So all on four, everybody talks about preserving bone, growing bone, saving bone, but all on four, you have to make a lot of space for the inner arch. So now some of these surgeons are just with the teeth in and everything, just doing a term not very used very often, ostectomies. And entire dentition removal for an all-on-4 dental implant case. The maxillary, mandibular, alveolar ridges were removed to allow enough bone availability. But man, a lot of people posted they did not like this picture at all. That was too aggressive.
Think about it. If you are a dentist, then your commitment is to surviving a dentition for a lifetime, right? Because you're a really good dentist, and I can't remember who said this. I think it's Riccardo Mitrani who said this, but you're a really good dentist if your patient gets worse at the slowest rate possible.
Right? Slow down the rate of death.
So if you trace all of that back, how many unrestored teeth does one lose unless it's severe perio? What are your implants coming from? Mostly teeth that have had a crown and a post, and it's a root fracture. That's like the number one reason. The number two reason are traumas and accidents.
So if you're number one reason, what'd you say is number one? Teeth that were restored?
Yeah, like a tooth that is unrestored rarely is lost.
I can still remember dental school. I asked him, I said, which tooth lasts the longest? And he says, the one that a dentist never touched.
That's right. One of our clinical professors, a guy by the name of Winston Chi, actually wrote an editorial once in the American Academy of Aesthetic Dentistry, and he called it a enamel preservation fee, that a dentist should actually be paid an enamel preservation fee as opposed to procedures that you do, because once you take it away, you can never replace it. Now, talking in 2020, this is a viable conversation because adhesion. prior to adhesion, you couldn't do these things. When you needed mechanical retention, you needed to do the thing that you needed to do to satisfy that requirement. But you look at a Boeing airplane today, and you look outside the wing. How many screws do you see holding the pieces together? It's primarily adhesively bonded together. Adhesion works great when the environment is controlled. And as dentists, we sort of take the posture of, yes, laboratories get great results, but really, in the mouth, you can control that. You just have to make the commitment to a rubber dam. So adhesion is not complicated. Rubber dam can be difficult. Now, when you work in an environment that you've got to do something that you have 20 minutes to do something, and the rubber dam maybe takes 40 minutes to place on and isolate in multiple different ways, then that's the first thing that you give up. And I think that the awakening needs to come from the fact that it's not that the technology that's lacking, is creating that environment that then allows you to do it.
Yeah, I mean, it's come a long way. I remember when I was in dental school, I was so amazed that the ADA held the patents for, that bonding benefits of Dr. Michael Buonicor's back in 1955, yep. That all these patents on it, and Erwin Smeagol ran out with it with the American Society of Dental Aesthetics. So when I look around the globe, America's only, I hear things all the time saying, you're big in USC. They say, well, America only has only 4.5% of the PhD students. Well, America's only 4.5% of the population.
Yeah.
What's your point? They say, well, most of them come from Asia. Well, there's a hell of a lot more people in Asia,
yeah.
Little United States of America. But when I look at the dental industry, there's 211,000 Americans licensed, 150,000 general dentists, 32 hours a week or more, 30,000 specialists, 32 hours work or more. They're billing out about $119 billion. But the planet's got 2 million dentists, and they're billing out $500 billion. But most of all the growth is pretty just like the advanced economies. They grows 1.5%, 2.5%. The only thing double digit with oomph is implants and clear aligners. And they're in double digit growth. Will that affect a lot of your programming decision for your...
Let's analyze that for a second.
LA Dental Symposium. I always confuse LA Dental Symposium with WLA Dental Center, West LA Dental Center. So is West LA, that's a tougher part of town, isn't it?
No, actually, West LA Dental Center is fairly close to UCLA. It's somewhere between Santa Monica and Beverly Hills. I would say it's an upper middle class community. I've been there for over 20 years.
Yeah.
And
I thought it was more like Hollywood.
No.
Okay.
Hollywood would be more north, but LA is just so spread out. But you raised a really good point. You said the double digits are implants and clear aligners. Why do you think that is?
Well, at the end of the day, there's the biosphere popped up about 3.5 billion years ago. Your only goal is to reproduce, have offspring. So anything to make you look more attractive. If you're missing your front tooth, they're always gaming, trying to look better because in their unconscious, they want to attract a mate, reproduce, have offspring.
So that's what the patient wants, right?
I think at the unconscious level.
And I agree with you. If you feel better, you look better. There are studies that show that you'll succeed more, you'll work longer, you'll be more efficient, all of that. What I'd like you to sort of think about is the average person today knows about implants, right? Someone from TVs, billboards. Clear choice. So those people have gone to the public, right?
Mm-hmm.
I think one of the people who really maybe 10, 15 years ago brought cosmetic dentistry to the mainstream, and he deserves a lot of credit for that, is Bill Dorfman. Okay.
Is that what you're going to say?
Yeah, that's what it was. That Extreme Makeover show, right?
Mm-hmm.
What it did is it allowed the universe to be aware that there is such a thing that I can have. And then people started asking for it, right? And then the education started about that because it became a demand. Now, I can sit and argue and say some of the methods and methodologies may not be what I would agree with, but this is not about that. He deserves the credit for bringing it to the public. How come the majority of the dentists in the United States are unaware that you can seal proximal lesions? For the world, for that matter.
Well, I'll go really brutal because I like to go back in history. I think when you're in the present, you can get so confused and tribal and you miss the point. But when you go back to America, they started dental insurance about what was it, about 1948 in the California, Seattle, Oregon. It was the longshoremen's.
Mm-hmm.
So there was a union that solidified anything coming in and out of the country had to go through the longshoremen's union. It was the perfect choke point of a labor deal. And one of the first things they started was dental insurance. And those dental companies in Seattle, Washington, and Portland, Oregon, and California eventually turned into Delta Dental.
Yep.
And when was the radiograph invented? When did Röntgen invent? When did Röntgen invent the radiograph?
I don't recall. It's probably sometime in the 20s or 30s now.
Invent radiograph. So X-rays were discovered in 1895. So here it was 1958, and nobody had an X-ray machine. Mm-hmm. And then Delta started covering X-rays at 100%, and it was a domino effect across the country.
Okay.
And the hallmark of economics is that people chase incentives. Like when I was getting my MBA program, it was really sad to hear the people from hospitals. They say, we spend an hour with grandma and we get a $20 an exam. We get this, and we lose money on everything. So we have to do a biggie, and a biggie is anything 50 to 100 grand, like a hip, a knee, a bypass. And if we do 4 biggies a day, we can run everything at a loss and cover everything. And I'm just like, how sad. If you don't fillet grandpa open and redo a knee, or if you don't do a $50,000, $70,000, $100,000 procedure, you run everything at a loss. But incentives matter. And if there's no code for it, it's dead on arrival to 80% of the planet.
But I kind of
America?
feel that the public doesn't understand insurance. Medical insurance has no cap, right? If you get sick, you go to a hospital, no matter the cost, you're covered. You have a deductible that you sort of truly pay as an insurance, right? Dental insurance is a discount club that you pay a premium and you allow decision-making on some other person that then influences your doctor as to what to offer you or not. $2,000 is what they pay, and to get that $2,000, if you're going to do it legally for the major stuff, you have to pay $2,000 to get $2,000. How can you ever be comprehensive? Now, take that a step further. You are somebody who is like a young person, and you've got these interproximal areas that you could potentially seal, that you would never really get that initial MO filling that you would get that today is mostly composite. And if there's a way to sort of protect you against that, what is that worth? What is keeping that marginal? And, to get cosmetic work and redo your whole mouth or implants on 4, that's $20,000, $30,000, $100,000, depending on who does it. If you took a healthy hourly profit after your expenses, and you started doing some of these works like other professionals do, like if you're a lawyer, if you're an accountant, you basically have your fee and whatever else is on top. Don't you think that most people would opt for it because they don't have to pay, tens of thousands of dollars? They would pay $1,000, $2,000, get it protected. Because what happens to that class 2 cavity that you get the first time? The first time that you get it, if you get it first of all, let's just even go back. How do you decide which lesion you enter? Think about that. You look at an X-ray, right? And you take a look at that X-ray, and it is generally accepted that if you see it hit the DEJ, you enter. How do you enter? Buccal, mesial? Most people, you kind of go in and you start looking, right? Well, you can transluminate. And if you transluminate, you know where that is. And if you transluminate and you capture that image, you can transluminate later and see, did it grow? How come some of the people that never did it from the time they were 20, they still have that interproximal lesion the same? You've experienced that. Or you offer a patient to do something and they don't, year after year they come and you're really trying to fight to see, oh, maybe you should because it's a little more. 20 years ago, you didn't have translumination. Today, you can transluminate and look at it that way. There is a lady who has her PhD. Her name is Marwa Abdulaziz. She went to the University of Geneva. She spoke for us at the symposium. She's now working at UCSF on a sabbatical. She has a PhD, and part of that PhD was to start analyzing what you see in an X-ray and what you see once transilluminated, and then once you open the teeth, how accurate are you? And many times you enter, and you're like, okay, where is the decay? And sometimes you enter, and the decay is rampant. So our diagnostics for initiation are not being used properly because it's expensive, right? You have to pay $7,000 to have a care review unit, but you could get an addent light, which is what I use currently, and that addent light will sort of show you where it is. And that light is, I don't know, $300? And that gives you some sort of an idea. Next is photography, right? So if you have a photograph of a tooth, and that person comes back 5 years later, 3 years later, you compare the photographs, half of the things that you think were going to happen doesn't happen in some, and in others, things get worse where you didn't suspect it. Now, it's not perfect, but when you read your notes and you sort of say, this was under observation, what do you do with that? I mean, I know you've had Kyle Stanley here talking about AI. Let's look into the future a little bit. How cool is it if the judgment doesn't have to come from you because the technology can tell you something changed? And, you know, as a dentist, we kind of feel like unless we took something away and we built something and we inserted, we haven't worked and we don't deserve to get compensated well. Whereas maybe the thinking should be the opposite. Look at dermatology, right? For a second, get out of dentistry. Dermatology is one of the most popular areas of medicine because they rarely have emergencies. Most of what they do is elective. Patients want it because they understand it's good for them. And the media and they have invested in letting the people know, letting the public know. Look at the drug companies. There was a time that the doctor would give you whatever. Today, you'll know what Lunesta is and you'll ask for it and your doctor will have to learn. So back to what started this sort of tangent that we went on, implant companies have double-digit profits because they have taken it to the public. They're investing in educating the dentist and teaching them how to do it well. The cosmetic stuff started because of Bill Dorfman and the likes that sort of put it out there. And frankly, it's rewarding when you do it well because it's like something you see right away. It's art, it brings the artistic part of dentistry out, etc. And that's kind of fun to do. So it's pleasant for the people that like it. Why doesn't anybody show cases 10, 15 years later of these big makeovers? Have you seen one?
Absolutely. But all humans don't like facts. Like, I mean, I've been on Dental Town since 1998 every single day. Almost the smartest dentist you know. You say, well, how long do you think your posterior composites last compared to amalgam? They go, oh, I can count on one hand how many of my fillings have failed. I'm like, well, you know, when I talk to insurance people and they have hundreds of millions of claims, they're seeing like 6.5 years. So let's talk. And then they say, well, those are yours. I mean, obviously my hands, look at my hands. Obviously I'm gifted. I mean, I don't think they like facts. And I think AI is going to blow their mind because the insurance companies are using it first. And right now they just arrested a girl out by you who had submitted the same x-ray 60 times for a molar root canal. And she's going to go to jail for a long time. And so they're fraud. Glidewell next to you, they're using it to read impressions better than human. But I think the next phase is they're going to sit there and say, wow, I'm going to give you $1,000 benefit to a molar root canal. And if you do it at 5 years, 5% are extracted. He does it, 10% are extracted. Howard does it, 20% extracted. we're not going to subsidize Howard anymore. And I think, and I can tell dentists are not going to like this because they can't even tell you their fillings fail today.
But, let's talk about standard of care. We sort of agree that there's a certain level, or evidence-based dentistry, even better, right? How would you define evidence-based dentistry? That means if the average person sort of follows the general guidelines of something, and you look at it in multiple different ways, and you look and see what worked and what didn't, you draw conclusions that this approach, this procedure, this material is good or bad, then you pass that gospel based on your experience to others. Agreed?
Right.
What about the person who took extra care, reduced less, isolated immaculately, and did something and took 3 times as long, and let's just for argument's sake charge 3 times as much, which is still less than the cost of a crown and a root canal, okay? And would that patient be better off or worse off? That's really the part that's like, so I used to do aesthetics and reconstructive. One of my heroes is Frank Spear, because he, at a very young, he probably wouldn't even know me by name, but he showed me that you look comprehensively. I got involved in implant dentistry because...
You're old enough to remember when it was Quace and Spear were partners.
Yes, actually that just recently separated.
And the endodontists, the 2 big ones, Ruddle and...
Yep.
And
Buchanan is by our side, yeah. Right? But, like, not to sidetrack, but the whole concept of endo, I mean, we should leave decay that's deep alone and seal it and wait for symptoms before we take the pulp out. We don't think that way. An X-ray goes to an adjuster in the insurance and gets pre-authorized. The endo is approved prior to caries removal. So some of the paradigms of what we think, I think, can change. And there's a guy who's a Harvard MBA. His name is Michael Porter. I don't know if you've read anything by him.
Absolutely.
So one of the things I've taken out of that, he says there's basically 2 ways to succeed. One is if you're the cheapest. If you can be the cheapest and your focus is to be the cheapest, you will always be busy. The other is you have to be different. Now, I see dentistry going in a couple of different directions. I understand that if I'm a young grad today and I owe $500,000, someone's going to come give me a 401k, give me all of my CE, create an environment that I'm not committed, possibly pay some of my loan off. It's attractive financially and for my life. The other way, they're not going to make as much money. Those places don't really exist. Then you take a look at the practice, and you met my 2 sort of associates here with me, like Ya, who is one of the most brilliant people I've ever met, that really started just like this for training purposes, and she just finished her master's in HR. She's just that kind of a girl, and we've tried to redesign our systems.
Is that the taller one?
That's the taller one.
Oh, okay.
And the shorter one is Rachel, who really, in many ways in adhesive dentistry, knows a lot more than many other people, because she actually just follows all the protocols. And, when you start teaching something, you start sort of understanding it a little bit better. Why I'm sort of going there is you look at our office, and our office, about 30% of what you pay goes towards managing your appointments, managing the schedule, having somebody to answer your phone calls, pre-authorizing for insurance, right? Mm-hmm. So I could be 30% cheaper and make the same money if I could control the front desk costs. Add to that today you average person who is in their mid-20s, I've read that they will not stay at the same job more than 4 years. They constantly move around, right?
Oh, yeah.
So if that's the reality, and I just have a lady who's been with me more than I have been with this practice. Her name is Nancy Rosenboom. She's retiring at the end of this year. She's given more than 40 years to this practice. That is just not going to happen in the future. So the process of this dental approach is a bit hindering. I make tea times for golf. I don't talk to anybody. I basically go, there's a scheduler, I kind of schedule it. And I think if we can take some of the things that we get from other industries, maintain costs of things that don't create better patient care, emphasizing the technology and the education of the patient. And as a profession, I think the CDA and the ADA, they should take the lead of informing the public that, implants are great if you need it, but hey, if you seal your teeth, you may not even need a cavity. How come that's not popular? And why is it the same fee whether somebody uses a rubber dam or not? Wouldn't that encourage you not to use a rubber dam? If the buildup is included in a restoration or not, wouldn't that make you be like, why should I put a buildup? I've heard that the most profitable restoration for a restorative dentist is a single tooth implant in terms of the money that you make as a dentist, right? Mm-hmm. When you're doing a single tooth implant, isn't that kind of where you failed at saving a tooth? And that is your most profitable thing? What if the smallest class 2 was the most profitable thing in dentistry? Would more dentists want to learn that?
Well, it goes back to what I started in the beginning. What are the only two things growing double digit? Implant and clear aligners, and they're the most profitable because the insurance companies, whether it be private or government, don't set the fees for those. So when in the United States, for example, when Johnson signed into law Medicare, and when Medicare, first it was a relationship. For years it was like, well, what codes are you using? Then they started group coding it. But after 10, 20, 30, 40 years, they finally figured out your business, and then they lowered their reimbursement so there's almost no profit. So when the insurance company gives you, say, $180 for a filling, that's probably your cost. So when people gravitate to something where they can just set the fee in the profit zone, and that's an implant and clear aligners. And I mean, a dentist will go do, I think the hardest thing I do in my office is, when I see on the schedule, I got to go in there and I got to do a quadrant MOD composites on 2, 3. I mean, that's just an hour of sit down. It's intense. Work. Oh my God. There's no shortcuts. It's just, you're going to be in there for an hour. But that you're probably just breaking even.
Depends how you charge.
Well, I mean, if you're participating with the insurance, but 95% of U.S. dentists take Delta, according to Delta. Delta says 95%.
Great for Delta, terrible for 95% of the dentists, because it forces you to do things that is not better, to make diagnoses that is not the most conservative. How do you think your patients would feel if they knew that when you're giving them their options, that's even on your radar? I could do a filling here, and if I put a rubber dam, it would probably work pretty good. It's a little hard to do, and I'm basically going to break even, but I would.
Well, that's some of the emotional pushback we've had on this show with silver diamine fluoride. Some of the young pediatric dentists, they like to just paint on the silver diamine fluoride and kill the decay and do that every 6 months. And some of them feel like some of the pushback from the older guys are like, well, my God, I'm bill out pulpotomies and chrome steel crowns, 8 of them, and you want me to paint this stuff on there for, $15, or there might not even be an insurance code. So yeah, incentives matter. I mean, if you went over to the MBA program at USC and told them incentives don't matter, they'd laugh you out of the building. I mean,
but going back to cheapest or different, a movement is necessary here, right? A movement of people who are going to get out of what's normal and accepted and easy, that are willing, and I am part of that. I've started this a long time ago. I gave up Delta Dental the day that they would allow me to do a crown, but not an onlay.
Wow, right? What year was that?
I can't remember the year, but basically we sent something.
Nice, sticking to your principles, buddy. And it's okay, but let me give you the devil's advocate, because I know my homies, and they're gonna say, "Come on, dude, I'm in Salina, Kansas. You're out there in Hollywood. Big money."
I wish I was in Salina, Kansas, being able to do this. The overheads is probably less. They pay less rent. To get in and out of their offices is easier. Okay. The concept that insurance enables people to get the best thing. Take a family. And I'm surprised nobody has done this, or maybe somebody has done this, or you go find the person who's done this and bring it on the show. Pick a family and look at a 20-year projection of family of 4. How much did their employer or their company or they contribute to dental insurance? How much out of pocket did they pay to subsidize what they received? And what procedures were done for them? In a 20-year span, then see how many of those things got to be redone because there were restorative failures that are inevitable.
Well, tell the kids,
environment.
because the kids might not see this, but you asked me a question earlier, like when we got out of school in the 80s, there are all these legends out there doing all these full mouth veneer case. And I was a little uneasy with it because I knew a lot of them. And when their daughter was 16 and asked for that, she had to go get braces and bleaching. Yep. But when someone came in with a debit card, they billed it out. But if someone comes in and got the traditional upper 10 veneers done the typical LVI way, what would those look like in 10 years or 20 years?
Poor. The tissues would be always inflamed. You know, you can't bond subgingivally. If you accept that as a principle, you can't bond subgingivally. If you don't see your margins, you shouldn't bond. The worst restoration on the planet is a unbonded, bonded restoration. An amalgam is better. A glass ionomer on a lot of my older patients, right? Where if they don't have the temperament to really get it isolated, it's better for me not to do bonding. It's better for me to do a full crown. It's better for me to do a gold crown. That's not the discussion. The discussion is for the tooth that has not been invaded. At some point, the arithmetic of this is that there is somebody who dentists have not touched. Why is it touched for the first time, and are there alternatives? And how do you make those decisions? I look at our charts. My patients are extremely unique because they grow gum and they lose gum. And that's because I look at my own probings.
Oh, okay.
And it's like a 3 millimeter of recession. I look at that and I look back and it was 2 millimeters and then it becomes 3 millimeters before I had photographs and everything. And we make decisions. And when you're off a millimeter in 3, you're 33% in error. Based on that, you may make a recommendation. You don't know that. You just emotionally decide. Where I see the future, and I'm in the building process of this, I do not have the workflow to tell you, but if there's one thing I want to contribute a way that you come into an office, you get scanned at your first visit, 3D, where you really see where everything is. That scan gets saved. If you're young and you have your own enamel and etc., you see in radiographs and you look with transillumination and you capture that data, and don't be in a rush to get in there. Which proximal caries became a root canal in a year? And you know, I have friends that spend $10,000 a month to try to be on top of that Google page for patients to come in. What is wrong with you repairing and redoing some adhesive dentistry, like resin dentistry, that you did 10 times in a patient's life in 100 years? Do you need that many new patients if that was what you did? You don't. So we don't concentrate on the ones that trust us already. We go outside and then we try to get more patients to come and like, you know, there's this thing out there that says the new patient will do 30 or 40% more of your recommendation than your existing patient. Well, how much effort do you put on your first patient? And how much effort do you put on a recall? You know, 10 years ago, I stopped doing exams right after a prophy because I missed things.
I posted this just as my phone was ringing and dinging after I posted this. Which one was it? Oh, check out this. This is I posted this yesterday. 3-year trial by Professor Nicola Innes, INNES, shows no evidence to suggest fillings are more successful in treating tooth decay. 3-year trial. I mean, 43% of those participating in the study experienced toothache or dental infection, regardless of the treatment they did. And it's funny because this is on the pediatric forums, and I mean, could you imagine being a pediatric dentist saying, "Don't do that, just paint silver diamine fluoride," and then people saying that you know, this is a pediatric study that these fillings, there's no evidence to suggest they're more successful.
So if you think of tooth decay, right?
She's a pediatric dentist, teacher, and researcher. Her work is focused on improving the way we manage the disease dental caries.
So let's look at dental caries. It is an infectious, communicable, untreatable disease. Agreed? It's a bacterial infection that can go from tooth to tooth, person to person. We do not have a vaccine and we do not have a medication for it, right? So if you look at it in that perspective, by you doing a restoration and leaving a margin, you're always vulnerable to that. And the bigger that margin, the more vulnerability. And the closer to the tissues or below the tissue, the higher that vulnerability. So if there is a way to get the tooth to sort of heal itself, that would be a better solution. Unfortunately, it's not easy to do because we have patients that have to comply, and that's where we fail most of the time. Because when you finish a restoration, it's in good shape. It's some patients take great care and some don't. But my issue with just excessive restorative care is that initially it seems really good, but almost invariably when you look at it 2-3 decades later, the ones that have been more aggressively restored have the bigger problems.
So have you been following that the Fiction Dental trial?
No.
It's pretty cool. It's called the Fiction Dental trial. And it's basically researchers just, you said, oh, the cavity's through, we need to do a filling. And they're all sitting there looking at the data. And say that a lot of these professors who are pediatric dentists, researchers, whatever, they're saying, man, you don't have an argument for the filling.
It's the surgical model.
Yeah, right? It is the surgical model.
And the surgical model becomes extremely important when it's about replacement of other things. I learned, I have a resource for you. Go check out, maybe you already know about this, a place called Style Italiano.
Yeah, he's on the been on the show.
Look at the work that gets done there, right? And that's in Italy, and that's like you're telling me a guy in Kansas is gonna hear and say, well, this guy's in Hollywood. There are people in Morocco and Iraq doing dentistry like that, right? It's not like nicer offices, it's not better equipment, it's not better materials. Is they sort of bought into the philosophy of let's keep things supragingival.
Right.
And I think that adhesion has brought that to the game. And one of the hardest things I think is to unlearn something. It's easier to learn for the first time than to unlearn and go a different direction. And I think that once we get comfortable, we're just comfortable.
Right. Yeah, this is a This is a very interesting deal. I was very excited about Tufts the other day. Tufts had a Dr. Nikhil U. Nair, MS, PhD, developed bacteria that would make low-calorie sugar called tagatose that will not cause cavities. He actually made a sugar that tastes like sugar. It has 38% fewer cavities, but the bacteria can't cause decay from it.
Yeah, I mean, xylitol kind of had the same concept, right?
Mm-hmm.
That this is sugar that they can't metabolize. But looking at all of these things is great things because it's like thinking maybe the first approach should not be surgery. Think of the medical world, right? If they would sort of do your blood pressure and they would sort of get a plaque index and there's a whole series of things that you could do. And the first thing that they would tell you is, let's just do a bypass because, it may get clogged up later.
Right.
It's just, for me, 30 years into this, and look at the stress to the dental world. When you do a case that somebody spent $50,000, $60,000 with you, and that case is failing, that's not a good day at the office. And the management of that case is difficult. When you have a case that you did a class 2 that failed, are you that stressed out that you have to do it again? Probably not as much. I know you probably know who Dan Fisher is, right?
Yes.
So he's
South Jordan, Utah. Dan the Man Fisher.
There you go. He used to invite 2 people from each school once a year before the Sunshine Act kind of complicated that. And I had the privilege of going there and one of the things that I kind of wondered is here's this guy who's got this amazing material and he doesn't make anything for porcelain. He doesn't do indirect materials except impression materials. So I asked him and he says, the majority of the world can't afford indirect dentistry. So his focus is to sort of help those people. And then what he said is, if every office learned to charge by their time, then you make the right decisions because it makes no difference what you're doing. And if you look at other industries, the law industry, if you look at the accountants, if you look at the contractors, most of the world that hires professionals hires them that way. And as your skill gets more, your hourly rate goes more. And this sounds weird, but we've implemented in our office successfully. You know, if I take Delta and somebody wants a front tooth that looks really pretty, without lying and cheating about it, I can't have them pay for a better lab.
Right.
Is if a patient knows that, is that good for them? And I'm not trying to bash the dental insurance companies because their intent is not to be bad, but it's an agreement between the patient and that company. And if they understood more, maybe then they'll choose to use the insurance for things that make sense and go outside it.
So, have you set the date for your next year?
Yes.
So, okay. Okay, and also I'm a little confused. So I know the LA Dental Symposium, just LA Dental Symposium.
Yes.
The West LA Dental Center, that's your dental office. You have another website, ePoint Inc. ePoint Inc.
So that's a whole interesting story. We had a couple of people that sort of moved out of the area, and we wanted a front desk person to help us, and we just couldn't find it. So I went to recruiters, and through the recruiters, we found somebody that actually I found Yaw that way. And we started making all these training manuals so that as we bring people in, we can sort of show them what we want them to do for us, because we're a little different as far as insurance goes and all that kind of stuff, and somebody needs to explain that well to a patient. Then we thought we have a business opportunity, and ePoint was meant to become a recruiting agency specifically for fee-for-service dental offices, because a lot of my friends are suffering from not having the good front desk help that they need. What we quickly
front desk or assistant?
The purpose was front desk when we formed it, but then we discovered that that's not an easy thing to actually fill. There's not a lot of people out there who are willing to work for the salaries that's paid for that would have that level of skill and that level of customer service, because a person like that could work in the hospitality industry, can work in the food industry. They would basically have easier lives and make more money. So we've kind of failed at creating the talent. The demand for us to find it is there, but we can't equip it. So now we're sort of rethinking it, and we're thinking maybe we should have some training that we do for other people so that they can go in this direction. And when the USC continuing education program stopped, I needed an umbrella of a different company than my private practice to sort of run the LA Dental Symposium. So it went under there, and you know, where Kim was so helpful to us, and AGD sort of became a partner to sort of help us with the CE part of it. And these things were not pre-planned. They were just ends to a mean, if you will.
So have you set the dates for next year?
I believe it's November, I want to 6 and 7, the weekend after the election. The weekend of,
oh
I
my
should say.
Gosh. I love how on ePoint you spelled it EPO exclamation mark NT. I've never actually you do it twice. In one area you do it with a small E, then PO exclamation mark NT. But I love the way, I've never seen that before, where you threw in a
yeah, and it's been so difficult to actually get the right registrations for that stuff.
Oh, I know.
You know, we were sort of creative, and then many times you're creative and then you get roadblocks. That definitely was one of those situations.
Oh, I was telling you before, you know, I fly out of the country tomorrow, and just having that Roman numeral 2 after my name, my dad named me the second. I mean, half the countries, it just stops the whole system. I'm still going to the cemetery yelling at my dad because crazy names. But yeah, you put an exclamation mark in there.
Yes,
you just lost the whole Microsoft backbone of the internet.
Yep.
So the LA Dental Symposium, you it's not on your website when the dates is, or
6 and 7. No, we haven't really.
it's
I'm scouting for it currently, and we probably are gonna continue
after the
bringing
election.
some of the highlights of last year's.
So if you're so I cannot believe
6 and 7 of November is the dates. 2020.
November.
Yes.
So when is the election next year?
Isn't the election always the first Tuesday of
Is it?
every year? And that would be 2020,
Yeah,
right?
it is.
Yeah.
And 2020 will finally see clearly.
Hopefully. I can't wait.
You know, it's funny. I can't believe we're doing that election. That means a lot to me because the last election is what made this podcast.
Really?
Yeah, I mean, the last election, talk radio and social media, and these dentists had an hour commute to work. They said, "Dude, I can't listen to this crap an hour each way."
Yeah.
Even like me, I kind of like my news summaries on like Friday night. You can watch a couple of news programs.
Sure.
That kind of sums up the week.
Right.
But some people, they're watching that breakfast, lunch, and dinner. I mean, it's like tonight, the NFL game. That's perfect. I had a game Monday night. I have one game Thursday night, but I can't watch it 3 times a day.
Right.
And but anyway, they were all emailing me saying, "Dude, you start a dental podcast." And now, what I'm most proud of is not this podcast, the fact that now there's 60 people in dentistry uploading a dental podcast on Dentaltown. And the views are crazy. People do a podcast, they upload it to iTunes. You can upload it for free on Dentaltown. There's one guy on there who has 600,000 views just on Dentaltown. And then my advice to any podcasters, because I know there's a lot of people out there. I own a media company, dentistry. So I've been a dentist, but I've owned a media company since '94. And media is only the medium. And a lot of people, they do too much of one medium. I mean, there's print, there's Instagram, there's iTunes audio, YouTube visual, but all the podcasters, like we're doing this on video, even though I have a face for radio. You look like you were made for video.
Hardly, but thank you.
You have that Dorfman look. But my gosh, they're humans. They want to watch it. I can't believe all the people that do these audio podcasts have nothing on YouTube. And I would rather go video on that. But so yeah, that election means lots to me. So the next election is November 3rd.
Yeah.
And you'll be the weekend before or after?
The weekend after, 6 and 7. We just signed
6
the
and
hotel
7, and where are you going to be?
Same place, the Biltmore Hotel in downtown Los Angeles.
And what and that means something to you because that's where you're having every year. You just have relationships with the deal.
It's a great room. People are familiar. It's centrally located so that local people can come. And, we're getting more and more people that are coming from outside of Los Angeles. And frankly, my goal with that symposium is to let the audience see some of these people that ordinarily they would never cross paths unless they join these big academies where they have a lot to offer. And hopefully I can leverage that and then bring them back on for more like a detailed 1 or 2 day course that we're going to do.
And what do you think? Okay, so I was trying to get the address. So the address here is right here. So the address of that is the 506 South Grand Avenue, Los Angeles, California. So where's that at?
That is right in the heart of downtown Los Angeles.
Downtown.
It's like literally a mile away from the Staples Center.
And California, I mean, it's 10% of America. I mean, it's what, the 9th largest economy in the world. I think you could totally fill that thing out without ever even leaving Southern Cal. But you're getting international people.
It's what I would love is to get somebody who's in Chicago, somebody who's in the suburb of someplace. You went somewhere and we didn't quite finish there. If I worked in an area that I had a little more time and I wanted to have a little better time, and I would sort of see the ease of doing that type of dentistry that's not as stressful, my life would be better. My patients would be better. And they're not exposed. They don't see some of the things that you see and I see. And then, I'm not saying transform your entire practice. Do 1 case, do 2 cases. Some of the best dentistry I see is from some of the most uncommon places. And because people that typically go to become a dentist want to do really well.
Another thing I've noticed over the years, like say it's tomorrow, Saturday, I'm flying, it's international when your flight time's 13 and a half hours on one leg. But one thing I noticed, so much has changed. Like when I started lecturing international in 1990, you always had a translator.
Yep.
Now there's no translators. I mean, because 30 years ago, parents told their little kid, the international language of science is math, and the international language of business and everything else is English. And so now there's no translators. It's just amazing. Now, that doesn't mean they can all talk to you, because in LA, you can have a Hispanic friend who can understand her grandmother but can't speak it.
Right.
Which always blew my mind, that how can you understand grandma and not just parrot it back? But it's obviously a separate issue. But I have noticed going around the world, especially places like Singapore, Tokyo, France, a lot of people say, yeah, back in the 70s, I did it that American way, running back and forth, 4 operatories. I felt like I was born just to provide jobs for assistants and receptionists and all that stuff. And I got rid of it all and went down to 1 operatory and my iPhone, and my overhead dropped down to $100,000 a year. And now I do 300,000, take home 200. I used to do $1 million and take home 180. Yeah. Now I do 300, take home 200, and I'm not stressed. And then I also coach them that, so much of our stress is just by design. And in dentistry, there's so many threads on Dental Time about stress. You know what? Just slow down. And the way I was justified is because you're supposed to treat other people like you want to be treated. And a lot in dentistry, it's like when you're really, really stressed is because you only got 7 more minutes to finish this. Well, throw the clocks away.
Who decides that for you? Who decides what your fee should be? Who decides how long you should schedule? You do. And I don't know, like there's a movement in Europe right now, it's called slow dentistry.
Right.
And they have a very specific protocol that they're trying to create that defines the basic minimum of
that's
what an
Miguel, right?
Be.
Is that his movement, Miguel?
I know Marco Gresnik, and I know that he was featured on there. I don't know the name of the person that actually started it, but I kind of joined their social media and I watched some of the things that they do and say. And it's an interesting concept. It says like no dental visits should really be less than an hour. And I mean, that's just not that complicated to understand. Yet when we put 3 or 4 things, and I have done that. When I finished school for about 4 years, I worked in a really busy clinic, and I felt exhausted every day, and it's just really hard to finish something and know you didn't do your best.
I can't believe we went over an hour, but I want you to explain something, because there are some old people. Whenever I say, a quarter of my emails are still in dental school, and the rest of them, they're all under 30. But I get one from a 50, 60, 70-year-old every once in a while. And for those older guys out there, a lot of them tell me, you're huge on Instagram. They don't get what's the difference between Facebook and Instagram. Why do you think Instagram? Why do you think Mark Zuckerberg, son of a dentist, Ed Zuckerberg, why do you think his son paid $1 billion for Instagram, and why it's a big thing in your world? So explain to the old guys.
So let me tell you, I am more with the old guy than the young guy. What I have is a team who understands Instagram, and I'm trying to get better at it. My personal social media stuff is not that good. It's mixed of students, family, friends, etc. But what Instagram does is it allows you to broadcast something and show what you have done or what you can do, and people can pass it around so quickly. And that's the good part. The bad part is you see a lot of stuff that could be misleading as well. You see a before and after, you don't see a prep, you don't see anything like that, right? So I think in our area, Instagram has a lot of teaching opportunities that you could do if you standardize it. And that's something that we're talking about. We think we're sort of toying with the idea of starting something called iPreserve, which basically becomes a group of dentists that dedicate themselves to a particular practice and don't let the million reasons of why you shouldn't. Don't think that way. Think of why you should and find the ways to do it. So we have like a 5-year goal on that. And in that concept, what we think is you should make available to people in detail how you did something. I think Instagram can be huge that way with the Instagram TVs and so on. Mm-hmm. And I think the younger population gets that a lot. And the meeting that I'm here for, that I'm excited to see what they're doing.
Yeah.
Is just born that way. You know, we didn't send
The
a single flyer.
InfluenceDental.com. The DIA founders are Blake McClellan, founder of Implant Compare app, Dr. Narif Sanada, prosthodontist, Dr. Payman Payray Razy, general dentist, Dr. Benjamin Johnson, oral maxillofacial surgeon, Dr. Brian Balawaz, general dentist.
And, you know, you look at how from year 1 to year 2 this changed. It's dramatic. John Coy is the keynote speaker. This has to mean something for John to agree to do this. And I'm thrilled to see it, because that's the population that needs to sort of learn how to diagnose better, how to be conservative if that's what they choose, find the things they like to do and not do the things they don't want to do, because we live in an interdisciplinary world.
And I think Coyce is what he does better than anything. I mean, sure, he's a great world-class prosthodontist, second to none, all that kind of stuff. But for young kids, he's such a great mentor, because he's not going to make you feel bad. There's no stupid questions, and he just has a great. Is that the Greek personality? He's just a. I always tease him that his secret to all his crown and bridge is he sprays Windex on him before he cements him. Remember Greek Fat Wedding?
Yeah.
Remember that Windex thing? But he's just such a mentor, and he's with Picos, Michael Picos, same thing. These are just guys where, I mean, you can just, like I say, there's no stupid questions that take you under the thumb, and they're just so world class. And Joe Marnafar, he teaches right here in town.
He's the oral surgeon, right?
Yeah, at Midwestern. And my gosh, Brian Harris.
He's local.
Yeah. He's talk about a genetic family. His dad's a dentist, and dad had 4 sons, like I had 4 sons. So I when I found out there was a dentist in town who had 4 boys, and they were 10 years older than my 4 boys, I called them and said, "Can I got to be your friend." I said, "Can I spend the night with you? Can I?" And he said, "Well, I'm going to LVI." And I said, "Well, can I share a hotel with you?" And he said, "Sure." I figured since he knew I had 4 boys, he hoped I wasn't hitting on him. And but yeah, it was great. We went to LVI in the day. Then at night, we go in the hotel room, and he would just tell me all the advice of raising 4 boys. But 3 of his boys turned out to be dentists and 1 a lab tech. But my God, what an entrepreneurial family!
Yeah, Brian is just a great guy.
So what's the takeaway from that Influence Dental?
Well, you're asking me about 3 days too early.
Oh, so you haven't been to it yet?
I've never been to one, no.
Okay.
My main purpose, like I told you, is I want to see what it's like. And I'm really excited to go see Amanda Say. I've heard so many good things. I've never heard her speak. So I'm going to go watch her speak and some of the other speakers and see who I can work to bring to our symposium and expose their good work.
So those are all the speakers, all those, many more, all those are speaking?
Yes.
And who were you looking forward to go see?
Amanda Say.
Amanda Say.
Yes. She actually has joined John Coyce, I believe, and they're doing a big hands-on on direct resin, which I think is so needed. And, the country is big. So the more people that get exposed, the more will become interested. And at a symposium, you're not going to leave it and go do it and be an expert, but it gives you the resource to maybe go take Coy's class and learn that and become better.
Huh. And Amanda Say, she's from Mount Pleasant, South Carolina.
Yes. I've met her at a number of different meetings. We sort of both belong to the AAED, and I'm really excited to go see what she's presenting. And then some of the other younger people that I know, like this guy Adamo, I've never met, never really seen much of his work. He's very good in photography. And, it's going to be exciting to see these younger people who nobody knows about present.
And let me tell you about photography. It's Danny Dominguez is Danny Dominique. He's there too. But I mean, it's amazing how patients go to your website and you tell me that you're a member of the American Academy of Cosmetic Dentistry or Implant Dentistry or Coy Spear, whatever. You tell me all this stuff. I go to your website and you just look like some Joe Harry, and my gosh, patients are so visual. We were talking about that's why we do the podcast on YouTube too. Mm-hmm. My gosh, the people that get a digital camera and commit to it. Now, some I know can't commit to it, but they got an assistant that committed to it. And that was the what I wanted to tell you about your ePoint. And then we'll wrap this up, is the fact that on the ePoint deal, I was lecturing to like 100 DSO guys in Scottsdale the other day. And, you know, the big dilemma with anyone with associates is employee turnover.
Of course.
How do you keep your employees? And it's like, well, I hear the other end. What was the tipping point? Of course, people don't like their job. Of course, people like to stay in bed and eat donuts all day. But, you know, but what was the tipping point? They had a really big day. They didn't sleep well last night. They were doing that big molar endo, and they walked in there, and their Joe Friday dental assistant, she's gone now.
Yeah.
And then here's some temp that he couldn't pick out of a police lineup. And I tell those DSO guys there, man, you can't have, the reason you have dentist turnover is because you have employee turnover.
Yeah.
And stop the employee turnover. And once that dentist, like I have a rule of my assistants, you know, once they've been with me 15, 20, 30 years, I always say, you know, if you're going to call in sick, at least have the courtesy of texting me first so I can call in sick. And because I don't want to go work with a temp. And I mean, my gosh, when I have to go in and it's going to be a temp, you should see the sweet text I get, you know, because they know I just can't stand doing it.
So you want the uncensored answer to why we have a problem? And remember, we try to build ePoint and we can't staff it. We don't take care of them. You do a parallel of a 25-year-old person that gets a job at Nordstrom's. Good employee, responsible person, smart, picks things up. Follow that career for 10 years. See the growth pattern and what they get and the benefits and everything that they get in that world. And like the stress that they would have to go through compared to if they make a mistake in dentistry, it's much more dramatic, right? And any good person would feel bad if you nick something. When we make a mistake, someone gets hurt, right? That's stressful for someone who cares. So if you look at it in that paradigm, and I mean, I'm just going to say stuff that probably is going to create a lot of issues with a lot of dentists, and they may not like what I'm about to say. But why should a hygienist be paid more than a dental assistant? Your profit on a hygiene appointment is about $20 to $30 when you take everything away, the time that you put to schedule the patient, the part of the office that's rented for them and what they get paid. And I'm not saying they don't deserve what they get paid, but a chairside dental assistant is what enables you to do your best. And really, when you look, the plateau is like by the time you hit $25, $30 an hour, right? There's nowhere to go. Practice consultant advise you to get rid of them and get new ones. So that whole dynamic is unfortunately flawed. And how I try to keep mine interested is maybe I can't pay them the same as like, you know, some of the other things, but you saw me come here with 2 of them, right?
I know.
How many dental assistants go see what you see that could get inspired to be like, wow, look at that rubber dam and how much easier it is to work, for them to take the initiative to actually go and support what you learned.
So just in case he switched you, I mean, so many people have come on the show and said that, you know, for 30 years you go to CE, and this side of the room, every row is an office. It's dentist, reception, the whole team's there. And it just, you know, every row is a dentist. And then over here, it's all the dentists coming alone to save money. Yep. And you look at, you go pull the tax returns on this group makes twice as much as this group. I mean, they don't come to your office because they have a problem with some person in there. Well, you're only one of 5, 6, 7 people in your office. And my gosh, the people who take all their, like tomorrow, it'd be interesting on this influence deal. How many of those dentists came to the influencedental.com in Phoenix and they just came by themselves? And it's like, okay.
I would imagine majority.
Yeah. So it's like, okay, well, you came to Phoenix, you got all fired up, you're all charged up. Then you walk back in there Monday morning and your staff's like, you know, they're just not feeling it. So, well, I want to thank you for all that you do for dentistry. And it's I mean, you have some big, fundamental, lofty goals. And I'm sure you're more aware than anyone how difficult they are. I mean, it's so hard to turn around a train that's been going in the same direction for 70 years. But if anybody can do it, it was you. Thank you so much.
Thank you so much. I really appreciate being on the show. I know I can't turn the train around. I'm just looking for a car to go a different direction.